Hello everyone. I will discuss learning about being a medical office manager. Let's start. What does a medical office manager do? A medical office manager is a healthcare professional who plans, directs, and coordinates supportive services for a medical practice or clinic. These professionals are responsible for managing the daily operations of the practice while maintaining a professional workplace. Napakalawak ng responsibilities and duties as a medical office manager. Generally, purpose ng isang medical office manager ay ma-organize, i-monitor at kontrolin ang business operation of healthcare facilities, kasama na ang medical office, nursing home, clinic, hospital, and healthcare practitioner. Also, to ensure overall business operation of the medical office runs smoothly and professionally. Some of a medical office manager's additional responsibility may include scheduling and coordinating patient appointments. As a medical office manager, you need to ensure that your patients are seen by the doctor as close to their scheduled appointment time as possible. And you are the person who decided kung kailan at kung saan ang appointment. And also, you are the one to create patient waiting list and confirm appointments via text and email. Next is recording and updating personal and financial information for patient records. Dito naman, you have a record of patient's history, clinical finding, and diagnostic test result. And you need to update the patient's progress kung ito ba ay nakaka-recover o lumalala ang karamdaman o sakit. And update of medication. And also, you have a financial information of your patient like financial activities and payments. Next is verifying patient insurance with insurance company and helping with billing activities. If patients call to make an appointment, take time to discuss payment and insurance company coverage with them. Insurance company like SSS, Pag-ibig, PhilHealth, Manulife, and ProLife. You offer payment option and require the patient to verify who is responsible for their bill. Aside from any insurance they have, you have also a website when the forms can be accessed or simply send them via email. And you are the one who collecting information and statement regarding payment responsibility. In order to confirm insurance eligibility, your insurance information form should ask for patient's name and date of birth, name of the primary insurance, social security number of primary insured, insurance carrier, ID number, group number, and contact information for the insurance company including phone number, website, and address for submitting claim. Once you got insurance information, you should contact insurance company to verify the following pieces of information. Number 1, patient is indeed covered by the insurance. Number 2, insurance coverage effective dates. Number 3, in-network or out-of-network coverage. Number 4, services you are seeing the patient. For all covered, do they need pre-authorization and or a referral by a primary care physician? Number 5, amount of copay for service if any deductible amount has the deductible been met for the year. When patients arrive to their appointment, don't forget the copy of their ID and insurance card and collect any applicable copay and always have your patients verify their personal information each time they visit your office. Next is supervising office personnel and training new employees on office system, procedures, and job tasks. As a medical office manager, you need to observe your employees' performance and work standard and advise and guide them through various job duties and work situations. Also, to train your new employees to understand how their department and your office operates. Learn what guideline you use and policies you enforce, and aware of the expectation and procedures within the medical office. Next is participating in and managing administrative activities such as record keeping, mail distribution, and general office upkeep. Record keeping meaning you need to organize and storing all the documents, files, invoices relating to company activities. And also you need to maintain the good condition of healthcare facilities, and work standard. Next is maintaining confidentiality of personal and financial data in accordance with local, state, and federal governmental regulations. It means, as a medical office manager, dapat aware ka na na-maintain mo ang confidentiality of a personal and financial data dahil ito ay nasa law and regulation. Kasi once na nawala o nailabas ito in public, maaari kang patawan ng pagkakakulong o di kaya pagbabayarin ka ng multa. Next is average salary. The average salary for medical office manager is often determined by the candidate's level of education, experience, skills, and specialty, as well as the position's specific job responsibilities. Geographic location may also have an impact on earning potential. Sabi dito, ang salary ng isang medical office manager nakabase sa level of education. Ibig sabihin, nakadepende kung nakapagtapos ka ng BS degree. Next is nakadepende sa skills at kakayahan mo kung ilan kaya mong gawing duties or responsibility. And the last, the location, kung saan ka nagtatrabaho. Halimbawa, sa province, mababa ang rate salary. Hindi katulad sa city na mas mataas ang rate salary. Next is medical office manager requirements. Getting a job as a medical office manager involves certain requirements which will depend on the type of position you are applying for. However, here are some basic requirements that are standard across the profession. First is education. True that some individuals may be promoted to medical office manager after working in office support roles for a few years, you may be able to obtain this position sooner with advanced education. An associate degree is typically required to become a medical office manager, with some employers requiring or preferring a bachelor's degree. These professionals typically have degrees in business administration or related field. First requirement to become a medical office manager is education. If you're applying for the position of medical office manager, prefer ng hospital ang graduated from BS degree in healthcare administration, business, on a relevant field. It means you have knowledge at may kakayahan kang gawin ang duties ng isang pagiging medical office manager dahil graduated ka sa field na yan. And you have a chance to take the position of medical office manager. Next is training. For most medical office managers, training takes place on the job. Most individuals need some previous experience in a medical office or similar settings in order to become a candidate for this position. You have to undergo training includes learning basic administrative tasks like updating medical records, making copies, sending faxes, and filling, as well as bookkeeping, answer phones, greeting patients, and making sure that all visitors have a positive experience. And also, you are required to training specific to the position, including verifying insurance and booking patient appointments. Then, if you train those duties of medical office manager, you have a chance to take that position. Next is skills. Medical office manager requires a variety of hard and soft skills to succeed in this role. Some of these skills are learned on the job, while others can be developed outside of the field. Here are some of the most relevant and important skills. First is communication. As a medical office manager, you'll spend much of your day working directly with patient and staff, which will require you to be an effective communicator. You should be able to clearly communicate both verbally and in written formats like email. This may sometimes require you to adapt your communication style to better interact with different types of individual. Isa sa mga skills is communication. To have a good communication skills, it's not just talking and listening. Ibig sabihin, sa pakikinig at pakikipag-usap mo, dapat samahan mo ng pag-intindi at respeto para sa mga staff or employee mo at sa patient mo. And also, you are willing to learn from your staff in addition to teaching them. Next is attention to detail. You should feel comfortable paying close attention to the details to keep the office organized while avoiding errors. You will need to not only double check your own work carefully but also check the work of other office personnel to ensure consistency and accuracy. Sa attention to detail naman, dapat you are being detail-oriented. Sabi dito, not only to your own work, also to work of others office personnel. Diligent, diligent attention to details is also necessary to ensure paperwork is precisely completed, reimbursement procedures are followed, and health records are properly maintained. Next is leadership. You will be managing other office personnel while coordinating administrative duties. For this reason, strong leadership skills will help you effectively motivate employees, deal with issues when they arise, and ensure that the office runs smoothly. Leadership, it means you will be in good example for your employees. Na manage mo ng maayos ang iyong mga employee, you maintain the good condition of facilities at nahahandle mo ang mga issues at problema. Next is analytical skills. You'll be responsible for streamlining the medical office's processes and systems to improve efficiency and accuracy. This includes reviewing the office's current procedure and identifying areas for improvement while recommending the best way to enhance the office operations. Doing this successfully will require strong analytical skills. Analytical is ability to collect and analyze information and solve problems based on the information. It means if you collect, analyze, and reviewing the current information and current procedure and system, you can provide and solve the problems. As analytical skills, you are continually ask yourself regarding all processes, practices, and office procedure. Next is medical office manager work environment. Most medical office manager work full-time in a medical office or other healthcare practices. Some may have to work more than 40 hours a week during busy times of the year or address issues outside of business operation hours. While most of their time is spent in the office, these professionals may be required to travel outside of the office to make delivers or run other errands. Siyempre, sa medical office manager, ang isip natin, ang trabaho niya ay puro lang sa loob ng opisina. Pero pag may kailangan silang trabahuin sa labas, they are required to travel outside to other errands. Maybe coordinates with outside computer programs, consultant, and contractors. Next is responsibilities of medical office manager. Medical office manager oversee the services of healthcare providers. You might manage a specialist division or an entire facility. For the most part, you'll find work in office within the facility you direct. Requires vary from job to job, but most medical office managers have at least a bachelor's degree. Napakalawak na responsibilidad ng isang medical office manager. Imagine, almost an entire facility is your duties. That's why before you entering the position as a medical office manager, you are graduated from BS degree in healthcare administrative and you are undergo of training. Next is operational. As a medical office manager, your primary job is to make sure the practice is running smoothly. In a new practice, you most likely will develop standard procedures for a number of different activities within the practice to help the facility run as efficiently as possible. You may address various situations such as reducing wasteful and redundant costs such as paperwork. In operational, as medical office manager, you are ordering medical and office supplies and computer program. Ikaw ang magpo-purchase ng yan. Develop and implement office policies and procedures, operating and maintaining office equipment, recommendation for a new or additional equipment. Next is legal. Medical office managers need to be aware of all the laws that govern the operation of their practices, federal, state, and municipal. Your job is to keep up with changing laws to ensure the practice you manage is operating legally. As a medical office manager, you need to have a knowledge about regulation, rules, and also laws that govern the operation of their practices, federal, state, and municipal. Dapat lagi kang active at update about laws kung may pagbabago para ma-ensure mo na ang minamanage is operating legally. Include such matter as confidentiality in proper storage of information for patients, health and safety regulation, and equipment maintenance. At saka as a medical office manager, dapat ina-update mo ang mga medical personnel to their licensure kung ito ba ay expired na, and also the certification. Next is clerical. As a medical office manager, a good part of your job is to keep everything organized and orderly. Depending on the size of the office, you may often have to answer the phone and schedule appointments for patients. In a larger practice, you'll supervise clerical staff to handle activities such as filling patients' records, handling the billing, co-pays, and processing and filling insurance claims. Medical office manager or your staff also refer patients to other services and sometimes schedule appointments for them. Finally, you may serve as the accountant for the practice and keep financial records. As a medical office manager, you will become a clerical also. Lahat ng nabanggit ko, duties ng isang clerical as a medical office manager. Last is communication. As the medical office manager, one of your main job is to act as liaison for different parties. You'll schedule meetings to make the medical staff aware of any new developments such as the financial well-being of the practice or changes in insurance coverage. You may propose operational changes to the staff and the medical practitioners. You will most likely be in charge of staffing, including advertising open position, creating job description, hiring new employees, and developing personal policies. The office manager typically develops and carries out staff performance evaluations. You also may act as liaison to solve conflicts between staff members or address patient complaints and concerns. Liaison means person who acts to arrange and assist interaction between parties. Ibig sabihin, ikaw ang pumapagitna. Halimbawa, may problema between staff at may complaints and concern ang patient. You are the person who may act as liaison. Ikaw ang haharap at magsosolve ng problema. That's all. Thank you.